My name is Kristina Flynn. I'm one of the mobility aides here at Bethesda Deaconess Hospital, Milton. And the position was created to help mobilize patients. One of the biggest risks after surgery is a pulmonary embolism. And one of the best ways to prevent that is to walk and to mobilize patients. So I started out mostly on 2 North, which is generally a surgical floor. We have the post-op patients. We have a huge orthopedic program. And so I get to walk a lot of those patients. We have a big bariatric program, so I get to walk a lot of those patients. I do work on 3 North as well, which is a lot more medical patients. We do get surgical patients up there, but it's nice to change up kind of who you're seeing and learning about their diagnosis and how to treat it. But you can see a big change. It's nice to see people get better, especially with walking. You wouldn't realize how much of an impact it has, but especially for a patient with a new knee. They can't get out of bed the first day, they're struggling, they're getting to the chair, they can barely get to the bathroom, and then 3 days later they're leaving and they're walking laps around the unit. And that's really nice to see and know that you're a part of. It's tough when they don't want to because they're afraid, but you just kind of have to tell them, your doctor sent me, I'm here with physical therapy, you can get up, it's possible, and the only way that you're going to get better is if you do get up. And I think that kind of explaining to them the importance of it, they begin to feel safer in your care and they're more likely to get up with you. You can take it slow, we'll say only a couple steps, we have the chair right behind you, and you can grab a second pair of hands, it's totally fine. And the more that you explain to them, the safer they tend to feel, and I think that's a big part of it is the safety, is they don't want to fall, they don't want to hurt their new knee, they're in pain already and so they don't want to be in any more pain. But so explaining to them what's going on, having a good background and knowledge of what their situation is and how they're going to heal, it makes it easier for them, and it makes it easier for me if they want to get up. One day we had this patient who was confused, and she didn't know anyone's name. She called everyone her daughter's name. She was angry. She didn't know where she was. That happens. And I remember one day I went into her room expecting her to call me by her daughter's name, and she said, "Oh, Kristina, you're here." And I think I cried because she was here for a while, and it was big for her. She was becoming more lucid, and it was nice to see that. And I remember the day before she was so mad at me, and I don't think she remembered being mad at me. But it was nice that she smiled and said my name, and I must have, even if she didn't remember it, I made a positive impact on her one of the days that she was here.